Good afternoon, everybody. Chris from the Headache and Pain Management Centre here for your Monday. And today we're talking about what we now know about chronic back issues and what we actually know now about how chronic back issues begin. Because there's a few things that we now know from the research that probably haven't been considered before in a lot of your cases, and certainly a lot of others don't consider it at the moment. So if you are joining us, type in below, say hello, and I'm more than happy to answer the questions here for you. You can see I'm in my office today, just doing a bit of bookwork, and thought I'd just take a little bit of time out to tell you about all these things. So when it comes to chronic back pain, basically we're talking about how it's actually caused. So we know, as you've heard from other videos, that it's all about how sensitive the nervous system can be and how quickly your brain wants to give you the pain to protect you or warn you if something's not going quite right. G'day there, nice to see you. Thanks for joining me. So when we've got chronic back issues, it's all about trying to work out what's starting it, what's actually the causes of to make the pain actually happen and have it come out of your brain, like let you know that there could be some pain there. But one of the things about chronic back pain is that basically it can be an issue with the way that you're moving. Okay, so not necessarily the movement itself, but in the way that you're doing it. Okay, so quite often people will really brace very hard when you're moving around, thinking that bracing your core or really tightening up is the thing that will help them the most. This was sort of propagated by a big movement maybe 10 to 15 years ago about tightening the core and doing a lot of clenching type exercises in order to get things going. But we now know that it's not necessarily the clenching which is the issue. In fact, the clenching could be causing more of the issues. And certainly the way that I've looked at it for the last 10 years, that's probably the case for a lot of people, that there's a muscle in the front that's called psoas, which can get tight. If that's tight and you're tightening on top of the tightness, you're going to be more tight and you're not really able to move around. You generally see people who are sitting up really tall all the time. They're tightening their core, they're really clenching, and they actually just haven't had permission to just let everything go and relax. There's nothing better than sitting on the couch and just having a bit of a slouch, just to have a bit of a relax, and quite often that helps. So determining whether or not you actually need to stiffen up more or you need to let things go is one thing that can help chronic back pain. In fact, there was a couple of people that came through the clinic in the last week or two where came in with their chronic back symptoms. They couldn't touch their knees, and all we got them to do was to exhale as they went to pick something up, and all of a sudden they could bend another foot, even 2 feet down towards the ground. So from knees down to the floor, just by going as they kind of bend over and pick everything up. So actually letting things go sometimes can be just as effective as tightening things up. And that's one thing that isn't really recognised a lot, because they're talking more about tightening rather than actually freeing things up. So that's the first thing. Do we need to tighten things up, or do we just need to relax a little bit? That's the first thing. The second thing that we know now with chronic back issues is looking at the role of the psychological things. Okay, so we now know that people that have a history of depression or anxiety, people that have gone through a quite traumatic stress event, are more predisposed to getting pain and have more, they're more predisposed to actually just having the real disability that comes with the pain because of the fear, and also because of the lack of understanding of how their pain has actually come to pass, especially if they had an event, all the tissues have been healed up, and there's now, there's now this real chronic disability that's there. So looking at the psychosocial factors are really important as well. Okay, so looking at what is it scary to move? Do you know what is causing your pain in the first place? Do you understand it? Because if you don't understand what the cause of your pain is, then basically there's a more fear that comes with movement. So getting rid of that fear of movement is actually a really good first step. In fact, there's a few patients that we do see where we need to spend a bit of time just getting through what the pain is, educate how the brain works, and show that you can move before you do anything else, because quite often it's the fear and the fear avoidance of movement which is actually the biggest thing. Now, I want to be very clear here. It's not saying that you're making the pain up. Okay, your pain is real, the pain is there. It's about actually working through why the pain is there in the first place and going through all the factors as to how this pain can come to pass, especially if it's been there for quite a long time. Things like pain education, things like graded exposure, so doing, just building up movements, and even things like imaginary movements can be effective to reduce that pain, to reduce that fear of pain, to reduce that fear of movement, so that we can then do the things that really start to strengthen things up. So, you know, moving your back, doing some exercise, some gentle walking, some bending and some lifting to get the back muscles and joints all going. The third thing I'll actually say about the cause of chronic pain, chronic back pain in particular, is that when you are moving, sometimes actually just away, or how can I put this? It's only a link in the chain, which is the problem. Okay, so some people, they can't touch their toes, but if you, for example, get their back straight and use your hips to do it, then you can do it. It's actually getting some other parts. So when you're doing any type of movement, I would say it's not just one joint that's moving, it's a whole stack of joints. When you're moving your back, it's the combination of your back and your pelvis which is moving. So sometimes your spine's moving well, but the pelvis isn't. And sometimes it's the other way around, and sometimes there's no movement with either at all. So it's actually working out which part of the movement is the hardest part for you to do for whatever reason, whether it's because your brain is saying, hey, don't move that pelvis because it's dangerous. It could be because you think that there's a real issue with your back because you've seen something really scary on a scan and you're afraid that if you move something like that, that it could make it more damaging. It could be any of these things. Actually looking at every link in the chain, so the pelvis and the back, having a look at, you know, can you tilt one way and the other? Can you bend one way and the other? Can you laterally flex one way and the other? Looking at all of these different things to see where the restriction is. Quite often the restriction isn't one that's physical. It can actually be a protective restriction, as it were, where your brain goes, yeah, well, I'm happy for you to move bending and straightening, but I'm not happy for you to move side to side. Or I'm happy for you to bend forward and put your shoes on, but I'm not happy for you to stand up and bend forward to pick something up off the floor, even though it's the same movement. So it's actually working through which links in the chain, what the context is, and what the fear of the movement may be to get things all happening. So they're the three things that we know about chronic back issues, which we really need to tackle. You know, is it fear of movement? Is it fear of avoidance? Which chain in the movement, or which part of the chain is causing the restriction of the movement? They're really, really important things. The way that we treat that, if you're wanting to know about that, is actually diagnose what the actual cause of the pain is. We're not a one-size-fits-all clinic. We're not people that just go in and go, hey, you've got X condition, we're going to treat you with Y. It's actually looking at you individually to see what you actually see there on my, probably backwards, but you can see individual treatment plans to, sorry, there it is. Individual treatment plans to suit your specific headache or pain problem, which is exactly what we're about. So looking at you in a very individual way, putting a plan together for you and your pain, and not just a recipe cookie cutter thing, looking at all of the different things that can cause it. And the treatments could be things like some massage work, so trigger point stuff, can be some dry needling. Typically the Med-X is a really good thing. The Med-X machine is great for that. And also pain education, grading, and getting you more confident in the way that you move. So there's many, many different ways that we're able to do that. So if you are keen, if you are interested, if you want to start a conversation, type in below and I'm happy to start a conversation with you. But when it comes to back pain, that's what it's all about, working out what the actual cause is, not just going down a one-size-fits-all line, understanding how pain works and getting the best result for you. If you've got any questions, please type them below. If you know someone who is suffering with back pain and would find this video useful, please feel free to like, share, comment like you normally do below. Hey, that's been a really good video. I hope you enjoyed that. I'll be back later in the week with another Facebook Live video. Cheers and bye for now.